it's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Welcome back to this week's episode of Back to the Basics. I have a very special guest for you this week. I have a neuroendocrinologist who's going to tell you guys how important the brain-gut connection is. So I ramble about it all the time. All my patients know. But this gentleman has spent his life learning about traumatic brain injury and also teaching people how inflammation, which I talk about all the time, leads to disease, and also telling people that even though you might not have symptoms of your gut, whenever you're having symptoms of other diseases, it can possibly be your gut. So I am thrilled to introduce to you guys Dr. Mark Gordon. He has a plethora of things he's done in his life. I'm going to let him tell you a lot of them, but he is a board certified family medicine physician. He had education in clinical orthopedics, cosmetology, dermatology, and sports medicine. He's written several books. One of them is about anti-aging in medicine. He's done a lot of volunteer work. He's been a medical director. He's participated in tons of projects. He's been on HBO, ESPN, CNN, Fox, Good Morning America, on several Joe Rogan's experience shows as well. He has spent his life just taking care of a lot of people and teaching us a lot about traumatic brain injury. And so I would like for you to help me welcome Dr. Mark Gordon to the Back to the Basics podcast.
Thank you very much. Pleasure to be here.
So can you tell everyone briefly kind of, I guess, what you do or, what you're passionate about? We were kind of talking about it before we started, but give everyone like a little 5-minute synopsis of what is it like to be in a day in your life? What do you do?
Whoa. Okay. The bottom line is to do everything possible in the sciences to give people a chance of living an absolutely optimized life. And that starts obviously with making sure the brain works. And if the brain works, you need to make sure the support systems from all our organs below the neck are working as well. So in the area of neuroendocrinology, neuro for neurology and endocrinology for endocrinology implies that the relationship between our neurology or neurological system, our brain, and the endocrine system is tied together. And it turns out where the endocrine system that's in our brain, which is separate from below the neck, helps to regulate the way that different areas of the brain communicate, as well as production of key chemicals like neurotransmitters that helps us from being depressed, anxious, bipolar, and so forth. So the importance of a healthy endocrine system in the brain is a healthy mental state or mental health state. And how I got into this is back in the 90s. I had previously 6 head traumas, which I woke up one morning in the mid 90s with depression. And the medication that I was put on to did not really help. And my escape in life has always been to read. So in one of the articles I was reading, it said there was a relationship between trauma and the loss of these hormones. So I went and had my blood work done. And lo and behold, I was deficient in growth hormone, testosterone, and thyroid. And within 90 days of having it replaced, it was like the world opened back up to me. I was still in my game, in my practice and all the work I was doing. But it was that quiet moments where I had the problems. And I went back to my patient population that I'd been treating for hormonal replacement called anti-aging medicine. My first book was Interventional Endocrinology, which is my terminology for anti-aging medicine, since the community I was working in really thought it was inappropriate to say anti-aging medicine, But after a while telling them, wait a second, do you prescribe blood pressure medication for a person? They said, yes. What happens if you don't prescribe blood pressure medication and they have a heart attack or stroke? Doesn't that curtail their life? I said, yes. Well, by using a medication like a blood pressure medication, you're practicing anti-aging medicine. You're maintaining quality longevity medicine, if you will. Anyway, so what happened was from 95 until 2007, I was working with the NFL, NHL, a lot of sports people, and then a private population of people. who were on our protocol. And when I started going back to them and saying, hey, have you ever had depression? Have you ever had the, and yes, all of them had depression. And on top of that, I asked, did any of you have any kind of trauma, any head trauma or body trauma or chronic stress? And everybody had it. Prior to that, it was the reason for hormonal deficiencies as we mature, as we age. We believed it was genetic. It turned out it's not genetic. Our lifestyle, whether or not we physically active, we eat well, we drink well, we exercise well, we sleep well, we take care of our gut. These all influence the chemistry of our brain because it's all connected. The gut influences a lot of the inflammation that happens in the brain. When there's inflammation in the brain, what happens is your hormones are shut off in the brain. And that goes back to a 2013 article, which started it, which showed that if you have any form of inflammation, the area responsible for controlling the pituitary, called the hypothalamus, shuts down. Inflammation from vaccines cause it to shut down. The recent COVID epidemic has caused a lot of people to have infertility because of shutting down of the hormone regulation. So what I do is a very technical but readily available grouping of laboratory tests. The laboratory tests are interpreted through a AI software package that gives us not only the medical conditions that are present on a very in-depth scale, but it also gives us a predictive treatment regimen. So what we do is our patients come in, run the blood work, make sure their guts are working well with either GI mapping, which, as I shared with you, my daughter Allison takes care of that because of her training in GI gut. And we then treat them. And 90% of our treatment is all nutraceutical, natural products that influence the brain, which has been the battle that I've had, because a lot of people say, wait a second, how could quercetin help? How could PQQ, CoQ10, roseola, how can all these natural things really help? Don't you want a prescribed medication? Well, it turns out that all these products called nutraceuticals, these natural products, are real medicines.
Yeah.
So that's in essence what I do. Keeping it
Yeah.
short.
So it's so fascinating. And so that's kind of what we do at Modern Endocrine. We were talking about how, I feel like inflammation is the root of all disease.
Yes.
It's why we have symptoms. It's why we get diseases. It's why we age. It's why we die. It's why we feel bad. And so, I like that you do this big lab panel. So for people that are listening to this and my patients, that you've seen me, I get this giant lab panel, and a lot of people think like, do you really need all of that? Well, you do, because the point is to figure out how inflamed you are and then figure out all the things that aren't working. And so to your point, I never really thought about it, but neuroendocrinology, like we do kind of do that, because it is the gut brain connection is really important. And so I do love that you do that. We do a lot of GI maps as well. And that's what I'm finding. I was an endocrinologist for 6 years, and I did everything I was supposed to do. Like they taught me in, endocrinology and fellowship. And, I did all the things. I even did some functional medicine stuff on top of that, because what they teach you in school is really mostly garbage. But I was an endocrinologist for 6 years, and I never dabbled with the gut. I was just like, okay, I'm going to get hormones right. I'm going to, and so unfortunately for my patients for 6 years, I mean, I made people better, but I didn't make them as good as I could. And I got really frustrated last year, because I was like, all these people are so optimized, right? Like they're, according to their labs, they're optimized. And according to what they tell me they do, they're optimized. So I don't understand why some people, to your point, like feel great. And then some of them are still like, I don't feel well, And so that's kind of what led me to the gut brain connection, or neuroendocrinology, as you call it. And so we started doing gut studies in my practice, and it is wild what you find in people's guts. And then once you start cleaning that out and fixing it, it's like a light bulb goes off eventually. Like not at first, for people listening, if you're on a gut protocol and you're 3 weeks in, you don't like anyone. We know. You don't like us. You don't like, you don't like yourself. You don't like, but it gets better, right? Like it gets better. And so, you brought this up to me. You said, if you have a really, really good immune system, it's so good that sometimes you don't even have symptoms, but you may have a bad GI map. Is that right?
Correct. My daughter Allison, when we started introducing the GI map to our patient population 3-4 years ago, she said, Pop, you've got to do it. So I did it. I delayed, but I did it. And there were, there were bacteria, there was H. pylori, there was fusiform, there was this, there was that. And zonulin, which is it's a marker
Mhm.
for the tight junction between cells, it was high. But my IgA, which is the what we call secretory immunoglobulin, it's produced by the mucous tissue, which gives us the protection in our lining of our, all the mucous
Mhm.
membranes, nose, mouth, vagina, gut, and so forth. It was very high. And that was probably responsible for protecting me from having symptoms from the bacteria that were active. Staph and strep were there.
Yeah.
There was Staph aureus and strep species, from the mapping. And I had absolutely zero symptoms on it. And at the bottom it said, oh, go on this pattern of antibiotics. So on clarithromycin and amoxicillin, I think it was what I went on for a month's time. And, there was no change because I didn't have any symptoms before. Going back and having a repeat test before the end of this year to just compare the two.
Yeah, and with GI maps with us, I don't even use antibiotics a lot of the times. Like I try not to. So now
Mm-hmm.
there's a lot of really good herbs you can use. There's a
Right.
tea you can drink. Like because what I don't want to do in somebody like you is kill your good bacteria, right? So
Sure.
you probably are somebody that had amazing good bacteria. Now there are tons of people out there that have no good bacteria. And in that
Correct.
case, it's like, well, you might as well drop the bomb of the antibiotics and start over. Like we've already got Hiroshima here. So we might as well just
Right.
but I mean, there's more than one way to skin a cat, right? But I did think
Absolutely.
it was interesting that you said that to me because I do have a lot of patients who say to me when I bring it up, I had a conversation with 3 or 4 people today that they're like, I just still don't feel well. And I have exhausted, lab testing. And I'm like, well, we need to look at your gut. Well, I don't have a single symptom. And I'm like,
Mhm.
really? You don't have acid reflux. You're not bloated. You don't have, and usually sometimes they'll find one. But to your point, even if you don't have a symptom, it doesn't mean that your gut is balanced, right? It
Right.
doesn't mean that everything is okay. And so I want that to be like a point that people take away from this is like, if you
Mhm.
really are to a point where you're not feeling better and you are with a provider you trust and you do feel like your hormones are optimized, the thing I think about is gut first. Second of all is Dutch testing. We do a lot of Dutch testing to
Right.
see how hormones are metabolizing. But to your point, the gut brain connection is very important. And so you were also talking to me about cytokines and inflammation and different things that happen in your brain. And then you said this other word. Was it what did you say? Something that causes neuropathic pain.
Oh,
Sorry,
peroxynitrite.
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 What
Yeah,
is peroxynitrite?
peroxynitrite. Okay. Let me just step back for a second relative to being proactive. I
Yeah.
mean, one of our subdivisions in our mind is, do we wait until people are symptomatic, or do we become proactive and do things that make logical sense based upon certain patterns? Like you have a patient who is not getting better, and we have seen on lot of cases, we've seen on a lot of cases where the gut, a uh, very quiet form of inflammation, whether or not it's dysbiosis or overgrowth. And what happens is our body tries to maintain a balance until it is overworked to the point it crashes. Well, we can either wait until it crashes, or we can be proactive and benefit the patient before it crashes so we can catch it before they slip and fall. So, jumping into the area of peroxynitrite. Peroxynitrite is a free radical. It's actually called the reactive nitrogen species, which is one of the byproducts of the body trying to get rid of inflammatory radicals. In this particular situation, it is the reactive oxygen species, which are free radicals that are produced when the body is fighting to make energy to go against cancer, to take care of a mold or a bacteria, or to clean up debris in the brain or any place in the body. It generates these things called reactive oxygen species. Well, it turns out that the ROS's reactive oxygen species will combine with something called nitric oxide. Nitric oxide in the brain is a signaling molecule that tells one cell from one cell to another what to do, as well as the more specific use of it is to cause vasodilatation, blood vessels dilate. So what happens is you steal a nitric oxide, add it to the reactive oxygen species. It neutralizes the reactive oxygen species, but it makes this horrible chemical called peroxynitrite. Peroxynitrite is responsible for uh, killing three key enzymes in the brain. The one that makes serotonin and serotonin to melatonin. So when you have inflammation in the brain, that's why all these people develop depression. They develop insomnia. They develop sleep deprivation syndrome with depression, cognitive impairment, and so forth and so on, and fatigue. And then in the presentation I just gave in Utah was about peroxynitrite damages a enzyme in the area of the brain responsible for protecting us from Parkinson's disease. And it's called the substantia nigra. And the specific cells are the dopaminergic cells, the ones that make dopamine. And it's dopamine deficiency that leads to Parkinson's. Well, it turns out that this peroxynitrite stops the protection of the cells, so they can't make dopamine. So this is why Parkinson's occurs, and we've had a number of cases where we've reversed Parkinson's by addressing the inflammatory cascade that occurs in the brain. Cytokines, as you mentioned, are part of our normal immune system. When a bacteria, a mold, or a virus, or an inflammatory process secondary to a vaccine gets into our brain, the immune system in our brain, which is based upon these cells called microglia, they start releasing inflammatory chemicals. You might have heard of it in what's called the cytokine storm, which was responsible for killing everybody who had COVID because it dumped these inflammatory acid-like cytokines in the lungs and stopped the lungs from being able to exchange oxygen and carbon dioxide, so you suffocated in essence. So the cytokines are part of our normal system, and they become produced overactively. And there are things we can do naturally to drop it down. We can use gamma tocopherol, vitamin E. We can use N-acetylcysteine. We can use quercetin. We can use fish oil, omega-3, specifically DHA. We can use, or EPA. We can use a number of omega-3s to help to reduce these inflammatory processes. And they work just as well as a medication without the side effects of killing you, right? And another issue is they found that the COVID creates damage to the microbiome of the gut. So if you've had a vax, or if you've had actually the active illness, COVID, what'll happen is it'll denigrate the quality of the microbiome in your gut. And it turns out that there is one of the bacteria which is responsible for protecting us from cancer by the way that it stimulates our immune system and protects our body. And we lose that. So you have to put back into the body the probiotics, select the good probiotics to address these things. And we have to be, my daughter's very specific on the types of probiotics she used based upon the case. After antibiotics, after COVID, after stress, after alcohol, gastric ulcer, hyperacidity, and so forth. So you have to address all those things.
Do you know which strain you're talking about that's lower? You were talking about with COVID?
I have the article that she sent me, so I can make it available for you. There's a whole bifidus. They've got so many bugs in the gut, and it was one of the less common ones that's responsible. Ones that I don't talk about. Gut is not my area. That's why I'm happy to have my daughter Allison here. Yeah. Except she's on maternity leave now.
Yeah, I want to talk to Allison. Okay, so then going back to the peroxidine, what did you call it? Peroxynitrite. So you're telling me that when you are inflamed, like if you have inflammation, free radicals from whatever reason, you drink alcohol, you hit your head, you didn't go to sleep early enough, you have toxins, your insulin's really high, whatever. Then when we have these free radicals, you're telling me that nitric oxide is what connects to the free radicals and then creates this peroxynitrite?
Absolutely.
So nitric oxide is a vasodilator, yes. but I thought it was good to have nitric oxide.
Do you like what you've heard so far? If so, Modern Endocrine is now able to provide telehealth services in 8 states, including Arizona, Nevada, Oklahoma, Texas, Ohio, Illinois, Michigan, and Georgia. If you would like to become a patient, visit our website at www.modern-endocrine.com/contact. You can also email us at hello@modern-endocrine.com or call our office at 405-286-1571 to schedule an appointment. Please note, we no longer accept insurance for new patients. However, we do have customizable membership programs available. Your first visit will include a detailed intake, and lab orders will be provided to further assist us in developing your 10 stages to ultimate health plan. We do offer discounted lab rates with a nationwide lab service. And now back to the show.
No? Yes, it's good to have nitric oxide, but it's not good to have excessive amount of reactive oxygen species. And the only way that we can take care of the reactive oxygen species so that they don't have an opportunity to steal nitric oxide, how do I know that it steals it? Look at SPECT scans. What SPECT scans are really showing us is our areas of the brain where the nitric oxide has been stolen and has been used for whatever. But in my perception, it's used for adding to the reactive oxygen species. That's why we need to take in really good antioxidants, the whole gamut of antioxidants, whether or not it's vitamin C or things that suppress the development of peroxynitrite, like melatonin does.
So what about nitric oxide? So like I take nitric oxide every day. Is that a good thing? So nitric oxide's okay. Yeah. But you said vitamin E, you said vitamin C, you said quercetin, CoQ10.
Yep. Nitric
omegas.
Oxide, nitric oxide is very good. I take selenium because of selenium methionine and all its benefits there. Helps with the thyroid. Helps with the conversion of testosterone to DHT. A lot of people don't know that. It depresses the 5-alpha reductase, the enzyme responsible for converting testosterone to DHT. We need a little DHT, not a lot. So selenium works very well, but for us, minimizing reverse T3, selenium helps with that as long as everything else is in play. Good levels of cortisol, good levels of B6, B12, folic acid, B9, and iron, and selenium. These are all very important, and this is how we treat some of our thyroid-related problems.
So when this peroxynitrite is high, then you're saying that's what can cause mood issues because you're not able to make dopamine, serotonin, or melatonin. So it can not only cause mood issues, but it can cause sleep issues.
Correct. And it's because of L-thyroxine hydroxylase and also L-tryptophan decarboxylase. You need to have both those enzymes to go through serotonin and then to melatonin. In our population, I take care of only military. My daughter takes care of all the civilian population. All our military come to us with what? Depression, insomnia, and fatigue. And it's all due to the fact that they have chronic inflammation in the brain. And we know that by looking at some of the markers that we look at, and they are directly related to inflammation in the brain, curtailing the ability of the brain to make luteinizing hormone. It's one of the key markers. And then you get the Jostel index, which is also called the TSH index, thyroid stimulating hormone index, which is a mathematical model which relates TSH and T4. And when it's less than 1.3, it relates to central dysfunction of the thyroid mechanism. When you have it greater than 4.1, it implies it's all coming from the neck. And that's where we find the Hashimoto's and the Graves' disease by this pattern.
Yeah, I see so much inflammation in the brain, secondary hypothyroidism. It's pretty alarming how much you see. And then if doctors don't know what they're doing, they're not treating thyroid correctly. But what did you say about luteinizing hormone? So you're saying if luteinizing hormone is low, that's a good sign of inflammation in the brain?
Right. And the whole thing came out, I was sharing it prior to the recording, is that in 2013, a group of articles started to be published. And what they talked about, and try not to get too technical on it, is that inflammation shuts off one of the cells in the brain, the astrocytes. It's called a glial cell. It's a supportive cell, and it generates a chemical that they call PGE2, prostaglandin E2.
Yeah.
PGE2 needs to be available to the hypothalamus for when it signals for gonadotropic releasing hormone. So if you don't have PGE2, the hypothalamus can't release the gonadotropic releasing hormone to go to the pituitary to release FSH and LH. So when you have a person, you have to understand, I work with the military where all of them have trauma because IEDs, mortars, repetitive gunfire, subconcussive traumas, so forth and so on. It's a given that they've got trauma. And, we did a study 4 or 5 years ago looking at cytokines from the peripheral, from the blood, to tell us what's going on in the brain. You can't do that because the cytokines are produced throughout our entire body. So if you have an elevation in cytokines and the chemicals of inflammation, the question is, where's it coming from? Could be coming from the gut, could be coming from my inflamed ankle, or from my tendon, or from my back, or from the brain. You can't be specific. So the only way to find out about the cytokines is do spinal tap. And who wants to do a spinal tap? When was the last time you did a spinal tap? Okay. We used to do them all the time.
I probably did one in 2014. It's been a little while.
My last one was probably in 2001. Yeah.
No.
When I was last day.
Done one since then. So can you measure prostaglandin levels in the brain, the PGE2? Can that be measured in blood?
You get what's called a surrogate marker. So what happens is from their history that they've been exposed, my patient population, they've been exposed to a car accident, an assault, a slip and fall, chronic stress, blown up. My partner was blown up in his 4th tour of duty. And that put him onto a pathway 6 months later on 13 medications. His wife would tell me that she'd find him in the hall closet in a fetal position with his sidearm in his mouth. That's not healthy. And then he gets onto our protocol. 3 months later, he's off all his medication. He ends up getting an MBA from Pepperdine in business. He ends up co-founding a 501(c) veterans organization to help them get into our program. And he and his brother write a book that gets made into the movie Quiet Explosions that was nominated for 2 Academy Awards. And it talks about the work that we've done. It's not about me. It is a part about him because he was one of the cases. So about how to reverse everything. Another issue with the inflammation is that this peroxynitrite is responsible for migraines. When we drop the level by giving them high dosing of things that will drop it, like vitamin D, DHEA, pregnenolone, progesterone, testosterone, making sure their thyroid's correct. What happens is you see them getting better and they get off their psychotropic medication, their medication for mood disorders and so forth, whatever they're on.
Yeah. So I'm just thinking, a couple things. I'm thinking about these young patients that I see. I saw a gentleman today, he's 29, and he has a testosterone of 320. And, that's not normal, although the blood work says that's normal, because anything from 200 to 1100 is normal. But if you're 29 years old, that's not normal. And his FSH is 2.7 and his LH is like 1.3. And he had a little bit of insulin resistance, like his insulin's 12. But, going through his labs, it wasn't awful. And so I talked to him a lot about his gut, and he admitted to not having a great diet. But then, so that's screaming he's got inflammation in his brain from something. Now, he's not, that I know of, he doesn't have a traumatic brain injury. He hasn't been in the military, hats off to those people. But so something's going on with his brain. Yeah. Like he's had some sort of, but it could be from his gut. Yes.
Yeah, could be from the gut, which we all need to look at. But the question is, what is a traumatic brain injury? I mean, how do you qualify someone as having a traumatic brain injury or not? What are the parameters that you need to have to be included into that category?
I have no idea. That's a great question for you. I think of somebody who's had like obviously a head blow, a significant car accident, but I don't know. Like, could it just be Could it just be like really significant verbal trauma? Could it be, I don't know, like childhood trauma?
Yes, it can be all that. And that is the reason why I asked, is because this is the dilemma in medicine. It's the dilemma in the way that the patients perceive that they've had head trauma. So we have a sheet that we give to them, because in asking them, have you ever had head trauma? And they'll say no. Why? Because the way they interpret it is traumatic brain injury or head trauma, they're knocked unconscious. There's another form of head trauma, which is called subconcussive head trauma. It's also called repetitive head injury syndrome, where it's these minor taps that happen. And a characteristic of subconcussive, when they have it, there are no symptoms. But what happens is, with over time and with repetitive injury, it leads to the case that I was flown out to Tampa to talk about, which is a 17-year-old man who jumped off a cliff and committed suicide. He had played wrestling and was in football, but never had head trauma. He had these micro traumas that were additive. And so what happened was, he left a video before he, took his own life, in which he explained how he was feeling, and no one in his family knew. No one knew. So what's happening out there is, a lot of people have had traumatic brain injury. Like, I had 6 head injuries that were only retrospectively did I look at them as being of significance. I never had loss of consciousness. I never had the, quote, bell rung kind of thing. They were taps, or they were situations, jumping out of a plane, or, preparing for parachuting and stuff like that, where you injured yourself, but you got up, brushed yourself off, and went back to work. And that's where we totally ignored. How about this? How about a tough delivery? How about bicycling when you're a kid, or learning how to walk before 1? You always fall. And how about skateboarding, or roller skating, or skiing? Or on one of the Joe Rogans, we talked about not snowboarding, what's it called? Ski-doo. In the water, the
skiing?
It's that the device that wave runner.
The tubing?
A wave runner. They got so many names for it. A wave runner. And from constantly hitting the water, that poundage. I just started working with the boat drivers for the what is it? This Navy SEALs, and they now have a multitude of problems. They weren't shot at. They was all with the fast boats and the pounding of the waves. A couple of them have been thrown off the boat, and these people develop symptoms. Okay.
What about just like repetitive inflammation from like alcohol use? Could that lead to traumatic brain injury? Or
terrible.
So like alcohol use or marijuana. What about marijuana? Some people say marijuana doesn't do anything. Like God put it on the earth. It's a plant. Like any sort of substance abuse
and
could
God
do this as well.
God put hemlock and poison ivy on the,
and cocaine and all sorts of stuff. Mushrooms that are,
I hear you.
Mushrooms that'll kill you and all sorts of stuff. But so any sort of substance that is going to change like the chemistry of your brain multiple times could be considered traumatic brain injury. What about so I was actually talking to my staff about this today. We have a girl and we know something's going on. We actually did a Dutch test on her. And so I know she's got some significant adrenal issues, which didn't really show up in her blood, interestingly. And she's got some different symptoms. And so we were talking about, I think there's probably some trauma involved, whether it's current trauma, whether it's abusive, whether it's mental, there's all sorts of trauma. But what about like long-term, negative self-talk, or long-term, just that feeling of like, just fear. A lot of people have this feeling of like, where am I going to get food? Do I have enough money to get food? Or, we just have this negative self-talk that we tell ourselves all the time.
Understood.
Could that cause significant trauma as well?
Absolutely. I was on the phone with a neuroscientist, PhD psychology at Baylor University. She had called because of a project I was peripherally involved in with bringing psychedelics to Texas and having the government pay for for the program at Baylor. So we talked, and I said to her, well, after we talked, real nice lady, really nice. And I said, I'm a New Yorker. I don't believe in PTSD. Now, PTSD is, post-traumatic stress disorder, which everybody says, PTSD will cause you to have depression, all these weird things happening to your mind and so forth. And I don't believe in it. I won't go into the deep story. I just stay on the superficial. So when I said that to her, phone goes dead. And I don't believe in PTSD. Phone goes dead. She's in charge of the Department of Defense, Veterans Administration at Baylor's for this area. And then she comes back and she says, why? I said, tell me everything you know about fractalkine. She pauses and she says, fractalkine? She's got this beautiful Texas twang. She says, fractalkine? I said, yeah, tell me everything you know about fractalkine. She says again, fractalkine? I said, yes, tell me what you know. She says, nothing. Well, it turns out that when you're under stress, chronic stress, zero physical trauma in your entire life, but you're under psychological stress from bad living environment, fear in the battlefield, whatever the situation is, fractalkine stops being made. And when fractalkine stops being made, the immune cells that we talked about earlier, the microglia that are responsible for releasing cytokines, start dumping inflammatory cytokines. And when you start dumping inflammatory cytokines, you get elevation in free radicals or oxidative load. That leads to the peroxynitrite. That leads to loss of serotonin, melatonin, and it kicks up another chemical, which is called kynurenic acid, which comes from L-tryptophan. And Dr. Takamura in Tokyo, in the Psych Institute, their research shows that this kynurenic acid is probably better associated with major depressive disorder, MDD, major depressive disorder, than serotonin is. We've been seeing in the literature since 2016, 17, where English studies were showing that serotonin does not always correlate with depression. You can have high levels of serotonin and have depression. You can have low levels of serotonin, not have depression. So he believes that this secondary chemical called kynurenic acid is the cause, and that is generated when you have peroxynitrite, stopping the conversion of L-tryptophan to serotonin and melatonin. So what happens in these cases of real PTSD, where you can go and say they've never had head trauma, nothing whatsoever. Last year, I did a project for the Department of Defense and Department of Health and Human Services. And it was to show them the science comparing PTSD to TBI. So I sent out an invitation to 250 of our veterans, and they had 72 hours to respond to keep it random. And 79 of them responded. The majority of the group had a diagnosis of PTSD by the Veterans Administration, and then a smaller group had pure TBI. They had already been in our program for a year. They all had the same testing, the same treatment, and they both had the same benefits, that 77% improvement. And it turned out that the group that was given the PTSD diagnosis, when I went back in their history, they all had traumatic brain injury where they had concussions. Some of them had repetitive head injury. So the VA DOD in their records really didn't look at it. Why? Because it happened either prior to their enlistment or after their enlistment, or they ignored the minor traumas that they had, the subconcussive traumas that they had while they were enlisted. The subconcussive traumas are probably best illustrated in our 50 caliber gunners. These are guys that are on Humvees with the 50 caliber machine gun. That's what they're doing. They're basically, the majority of them weren't around IEDs, but there were enough that were. But from that kind of repetitive micro traumas that will create it.
So you're saying that you don't believe PTSD is a real thing because really what it is they've had repetitive stress. They've had trauma. Trauma, inflammation, basically repetitive inflammation. I don't even know if you need to use the word trauma, but inflammation.
Yeah, it's a physical. Well, the difference is there is something called traumatic and non-traumatic head injury.
Okay.
Traumatic injury has a physical force or a transfer of energy from the outside to the inside through the skull. And then you've got the ones that have non-traumatic, which are the ones you already stated. People with medication, chronic stress, in bad living environments, alcohol, finasteride, durasteride. There are specific medications that will cause the instigation or the initiation of inflammatory pathways in the brain.
What about statins? Do you think statins cause issues with long-term mental? I know they do with thyroid, and I know that they do with glucose. But what about, they're supposed to be anti-inflammatory, but do you feel like I have a lot of people who start statins and they get pretty significant brain fog?
Yeah. Well, there are articles about the use of statins in traumatic brain injury for what you just said. It can lower some of the things like interleukin-6, one of the inflammatory cytokines. But the most important thing is the fact that 25 to 30% of the dry weight of the brain is based upon cholesterol. And cholesterol is important for neurons and also for synapses. So the quality of the nerves and the quality of the communication between nerves. This was in the lecture I gave, which was called Alzheimer's Disease, Understanding a Hormonal Treatment Protocol. So I went through basically how important cholesterol is for every one of the cells in the brain, the neurons, the oligodendrocytes, the glial cells, the periocytes. They all need cholesterol for their cell membrane, as well as a fuel or a substrate to convert into hormones in the brain, like pregnenolone, allopregnenolone, pregnenadiol, these very, very important hormones, which in a lot of the testing packages that are out there, they don't include. And one of the areas that is not really looked at is the relationship between DHEA, pregnenolone, progesterone, and cortisol. So when we hear doctors who focus in on cortisol, if they don't look at DHEA and find the pregnenolone steal syndrome, they miss the mechanism by which the body has turned on a switch to try and save survival mode with the pregnenolone steal syndrome. Very important in terms of those hormones. Insomnia. Almost 100% of our veterans who have been exposed to blast trauma have insomnia and depression. You check the pregnenolone and the progesterone level, they're low or non-existent, which brings us to an issue. You started the conversation about hormonal ranges. One of the greatest fallacies in our interpretation and the training that we receive for hormones is you've got a hormone or a chemical that normal range is 10 to 90. If it's 11, what does a traditional doctor say? Normal.
It's fine. It's fine.
It's fine. It's okay. It's lower length, but you're in the normal range. Well, what we've found in the past 30 years of the work that I've been doing, 43 years total in medicine, 30 years in this area, 31 almost, is that 50th percentile to the 75th percentile of the laboratory range is where you get the therapeutic benefits. Not at the first quartile, the 0 to 25%. It's going up to the 50 to 75. And in the case of multiple sclerosis, Parkinson's, Alzheimer's, and dementia that we've reversed, it's by bringing them to 75th to 100th percentile. And this is most of the work that I would work in, how to reverse.
And so you're talking about progesterone and pregnenolone levels, and you're talking about in men as well, correct?
Correct. Our blood testing, 28 points, exactly the same for males as females. Why? In a woman, estrone and estradiol are two of the key ones that we look at. Well, it turns out that men also produce estrone and estradiol. And it just so happens that the Framingham, the heart study, the people in Massachusetts, they found that if estrone is higher than estradiol, that it increases your risk for diabetes, some 50 to 93%. So we check these hormones in males because it's the same thing in males and females. In fact, the lead article from Framingham study was in men. Having higher estrone than estradiol increased their risk significantly for diabetes. So we do.
Estrone also increases your risk of developing breast cancer as a woman if you have a higher estrone than estradiol level. But I've been reading articles about this, and I've been talking to some men about this recently, about men who have significant insomnia and have no progesterone, giving them like tiny doses of progesterone, and they think I'm lost my mind. And I'm like, well,
You use
so
pregnenolone?
you're telling me I haven't lost my mind?
No. Have you been using pregnenolone?
I do use some pregnenolone. I do.
We
Probably not
use
as much as I should. So I
100%.
want to get this list from you of all the labs you do, because now I'm intrigued. Now I do check pregnenolone with Dutch testing, right? But I use pregnenolone a little bit. I used it a lot more in 2020, 2021. It kind of fell off of my radar. But I do know that progesterone, I mean, you can change a woman's life with progesterone. But then I found this information. Actually, my good friend Dr. D was telling me about this. And so I was reading about it, about progesterone in men. And it makes sense.
Yeah. But if I
So
were to tell you that the cost parameter and the perception parameters between pregnenolone and pregnenolone for a year supply is $80. For progesterone, which is through a prescription, can be about $1,000 a year. And what I do, I work in molecular chemistry, in molecular biology. So we know that when you ingest a fat-soluble hormone like pregnenolone, that it gets absorbed, it passes in the blood-brain barrier, and there are studies showing how it converts, gets absorbed in the gut, goes through the blood-brain barrier, gets into the brain, gets converted to allopregnanolone, which is the key. Pregnenolone, progesterone are precursors for the allopregnanolone. And there's a pharmaceutical drug out there called Zulrosso, which is about $100,000 a year. $34,000 for the medication. Then you have to go to the hospital for 30 hours a month to get it IV infused. You might have seen it for treating postpartum depression. But the added benefits are antidepressant, anti-anxiety, improved sleep. Because pregnenolone, progesterone, allopregnanolone, what do? They're synaptogenic, free radical scavenging, neuroregenerative on one side, and on the other side, it increases GABA production. And you asked a question about marijuana. Well, it turns out that why people develop resistance to marijuana, they need more and more and more, is because CPD, or the CB1 receptor, which marijuana goes to, turns on. When you turn it on, you increase pregnenolone production. And what does pregnenolone do? It blocks the CP1 receptors, so that you need more marijuana, more delta-9 THC and CBD to get the beneficial effects. So in fact, the literature has articles where pregnenolone not only helps you to detox from benzodiazepines, the Valiums and so forth, but it also blocks the effect of marijuana. So if you have people who are on marijuana and they want to get off of it, pregnenolone works. I had a guy that for 35 years smoked a joint for breakfast, a joint for lunch, and a joint for dinner for 35 years. 6 months on one of our programs, he calls up and says, "Doc, I woke up this morning, I had no craving for marijuana." I said, "Is that good or bad?" Because I wasn't going after that. And that's what led me to start researching how it works. So pregnenolone, phenomenal. I don't use progesterone. We did a study on 5 to 10 milligrams at nighttime of progesterone, oral capsule or liquid, sublingual, to help them with sleep if they were insomniac. But it turned out that cheaper and less, problems with, I'm taking progesterone. They would take it $80 versus $1,000 a year. And the science there to show that it gets absorbed and gets into the brain 4 or 5 times more in the brain than the circulation.
So 2 points though. If you're listening to this and you're a woman on hormone replacement therapy and you're on estrogen and you have a uterus, you have to take progesterone. So don't stop your progesterone because you don't think it's helping you sleep. So just caveat. Number 2 though, pregnenolone. So what dose of pregnenolone? Is this like 100 at bedtime? How much are you giving people?
I start off, I look at the range that they have. And if they fall into the first or second quartile, it's 100 milligrams. Okay. If they fall into the third quartile, which is the 50 to 75 percentile, I'll give them either 50 or 30. There's a side effect, a very rare. We've got, 10,000 patients. We have maybe 5 or 6 that developed a really weird symptom that took me 5 years to find the article. They developed like they were on speed. a paradoxical response because pregnenolone has 100 times more gamma, GABA response, 100 times stronger GABA response. So it's sedating, but they were bouncing off the wall. Turns out that in these rare cases, there's crosstalk between the excitatory neuron NMDA receptors. So we rarely see it, but it does occur, and it's a good thing to know. So don't think the patient's crazy.
Yeah, and so these are people with insomnia, right? You're not saying that every single human needs to take pregnenolone. It's just if you're having a lot of issues with sleeping, this is one of the things that you can look at. Okay.
For jet lag, also for jet lag, better than melatonin. If you use melatonin.
I don't love melatonin at all. I like creatine for jet lag.
Really?
But
creatine monohydrate?
Yeah. So honestly, what I've found is if you take like 15 grams, like prior to travel, so 3 scoops, couple days prior to travel on your day of travel. And when you get somewhere, especially if you're changing big time zones, like my sister lives in Australia, here to Australia, 15 hours, here to Thailand, that helps with jet lag. But I've never tried the pregnenolone. So I will do that. Obviously staying hydrated helps too. And tip for people traveling long distances like that, the best thing you can do too is fast while you're traveling, right? Because you don't want to fill yourself with a bunch of crap and alcohol. That makes your jet lag worse.
Oh, shucks.
FYI.
It's the best time to do it.
Getting hammered on the plane and passing out, not the best plan.
Yeah, but with all the reserve stuff I have on board, I wake up at 6 o'clock in the morning in Thailand and start working in the hospital at 7.
Yeah.
I've worked in Southeast Asia since 2006.
Yeah.
So, yeah.
That's okay.
Yeah.
So this is all so fascinating. So, going back to like the mood and the anxiety, depression. So I see so many women, unfortunately men too, who have debilitating anxiety and depression. And so now you're making me think like in these people where we get their hormones optimized, I'm huge at insulin. I'm big CRP, but in these people where I get all this stuff optimized and they're still having issues, I really need to be trying to figure out where the trauma came from. And you said it can not only be traumatic, but non-traumatic. And so I'm now honestly, Dr. Gordon, like terrified as to what's going on with the world, because if you really think about it, non-traumatic brain trauma, like it would be hard to say that a lot of people haven't experienced that. If you're on social media, if you watch the news, if you know what I mean? Like we're just the hardest on ourselves. And so all this truth about like negative self-talk and meditation, mindfulness, all these things really is something that maybe should be brought to the forefront of not only medicine and education, but just education for people, right? Like, I'm big on sleep and diet, but what you're telling me is kind of blowing my mind, because I have patients I'm thinking about in my head right now that I know they have a pretty good lifestyle. I know I've cleaned up their gut. I know we've done a lot of these things. And so it just could be some inflammation in their brain that's causing a lot of these symptoms, mood symptoms, things like that.
Absolutely. Also, deficiency of pregnenolone. If you check the pregnenolone on every single one of your patients, you will start seeing a pattern between their lifestyle, meaning what exposures they've had, and their levels. I mean, I can predict, generally speaking, in a veteran coming into us, just looking at their history, there's a paper they fill out that tells me, that they were exposed to blast, they shot this, they shot that, what they were exposed to. And then you find that their level of pregnenolone is so low, it directly correlates to their ability to sleep. And that's because of the effect on GABA. Another benefit of pregnenolone and how we've helped with dementia is that pregnenolone upregulates acetylcholine in 4 different major areas of the brain. And acetylcholine is what is the major focus for Alzheimer's, why they get the cognitive, because you lose the key neurotransmitter. So pregnenolone upregulates it. And there's a study that came out where 11.2 milligrams snorted into the nose causes immediately to have an increase in acetylcholine with clarity of the brain. And then we have certain peptides that upregulate the brain's functioning.
So can you take us? Sorry, go ahead.
Yeah, something called Cmax or inositol Cmax or ARA 290. There are some incredible peptides out there. that we've
Yeah.
used on
Does dihexa do that? Is dihexa one of them that increases N-acetylcholine in the brain as well?
I don't know about that. I haven't gotten to it. I haven't used it.
But
I'm very
CMAX
focused.
does. Yeah.
Yes, CMAX does brain-derived neurotrophic factor. ARA 290 drops the inflammation in the brain. Um, there are a lot of ways of doing it. Cerebral lysin for Alzheimer's, but it comes from pork brain. And if you don't eat pork, it's kind of, if you're halal,
So tell me this, can you take pregnenolone and progesterone? Let's say you're a woman who's,
absolutely. All our women.
menopausal,
Oh,
postmenopausal, you can do 100 or 200 milligrams of progesterone with pregnenolone?
yeah, our protocol for women. My daughter Allison takes care of most of the women because in my military, it's so many more males than females. But I do have women. Yes, we put them onto progesterone because pregnenolone serves a function, and pregnenolone converts to pregnenolone, which serves a function, and pregnenolone also converts to progesterone. So a lot of times we can get the progesterone through the pregnenolone, not always. So we do give them progesterone in a cream, and all our delivery systems are vaginal for our women with the HRT protocol project we started in 2006 was intravaginal. We get to use lower dose, and we get to mix all of the hormones together, and it works very well for dyspareunia, for vaginal atrophy, and for prolapse, because the broad and round ligaments of the uterus are sensitive to testosterone and estradiol, so they can tighten up. So in tightening up, they can bring the uterus back up. It's neat stuff.
Yeah. So besides estradiol, estrone, progesterone, pregnenolone, you and I were talking briefly before, insulin, cortisol,
Right.
all the hormones.
Right.
Is there another lab that I'm missing that's like a must get lab?
I'll send you the list of what we do. And the only thing is that the software that I wrote over 10 years does a 28 point by 28 point, 28 to the 28th power interpretation, because, there's an interaction between when you elevate growth hormone, it influences prolactin. Prolactin influences luteinizing hormone. Growth hormone will accelerate the conversion of T4 to T3. So if you have, low selenium, low iron, you'll get more reverse T3 and get the low T3 syndrome. So it's understanding, the software understands how to do the interpretation at a level that we as humans, it's kind of tough to do. I've been doing it for 30 years, and I just put it into software, into our algorithms for the software. So yeah, we can make arrangements so you can play with that software and you can see what it is. We have 123 centers in 12 countries that are using it. We have 5 more countries coming up. Australia, we're working with now with the military there, and New Zealand, Malaysia, Philippines, Thailand, and Malaysia. Yeah, that's it for now.
Yeah, that's fascinating. I would love to look at that because I do understand a lot of that. Being an endocrinologist, I get a lot of that reverse T3 growth hormone, how growth hormone affects, insulin and a lot of different things. So I would be fascinated to look at that. I'm sure.
Yeah, I'd interject. You're a little bit outside of the traditional endocrinology world, because most endocrinologists think that reverse T3 is insignificant.
No.
Yeah.
I had a lady today whose reverse T3 was 7, and I was like jumping up and down excited because it started at 23. And it was because actually she had an iodine deficiency, she had a ferritin deficiency, she had a B12 deficiency, like she had all these deficiencies, and she had a gut issue. And so we had to clean up her gut. We had to clean up her, all of her micronutrients so that her labs or her hormones could actually convert. But I was so excited. I saw a reverse T3 of 7 today. And it's been a long time since I've seen a reverse T3 in single digits. So I was very happy today. But yeah, no, I'm a little different. I would say that I don't know. I know one endocrinologist that's somewhat functional. I just met her last month. But other than that, I used to say I'm the endocrinology unicorn. Like I've never met an endocrinologist like me who actually understands and believes the true functional medicine world. So I would love to look at your software and play with it. And like, I doubt there's anything I could offer, but maybe. And the gut, like you should, maybe your daughter and I could talk about helping you interpret gut stuff into a software, because I am so fascinated about the gut. And, you know, this is just like my passion. I love more than anything when people come in and say, you know, you've changed my life. And this is, and you've changed my life by taking me off medications. Like I saw a lady this morning, love her dearly. She was diagnosed with breast cancer this year. But you know, we changed her life with hormones, and her biggest concern was they're going to take those hormones away from me and I'm going to be this person that I was before I met you, and I'm not okay with it. And, you know, I reassured her, we're not going to do that. We're going to give you hormones safely. But I love when, like her, when she came to me, she was on all these medications. She was not feeling well. And now she's not on any medications and she's feeling wonderful. And it's like, that's why you get up and go to work every day, right? Like it's the most rewarding. It's the most rewarding job. And the more you do it and the more you help people, you know, that's the only reason I started this podcast. I was so sick of hearing all this nonsense on social media and just poor education about how pills fix things and just take another pill. And like, I literally was walking my dog and I got so angry in February listening to something. I came upstairs, ordered a camera, the sign behind me told my husband I'm starting a podcast. He thought I'd lost my mind. And I started talking to people like you. I started talking to and putting stuff on social media because it just infuriates me it's just so angry. Makes me so angry.
I'm going to refer another endocrinologist, functional endocrinologist, Dr. Ed Lee in Orlando. Ed, we corrupted over 15 years ago. And I just introduced him this weekend in Utah for a program that we were both at. I grabbed him and he travels with me to Thailand. But he's Korean and his family almost disowned him when he said that he wanted to go into a form of endocrinology where he would be proactive, not reactive. So he's been doing this and has done very well. He's written books and everything. He and I work together with peptides. He founded a clinical peptide society out of Florida. But I think the two of you would have so much synergy because you came from the same roots. You know, I think it would be very exciting. I'll put it down in my notes to get.
I would be honored to be introduced to Dr. Lee. That would be amazing. So then I wouldn't feel like I'm on this island by myself.
You are a unicorn, and that's why we love you. Okay, because you're brave enough to stand up and say, "Wait a second, traditional medicine is not what our patients, our clients want. They want something beyond." You probably experienced the same effect of COVID when COVID hit. And there was no resolve for those people getting infection. They started realizing, the patients started realizing that their doctors were ineffective. And so what happened with my population, and when we go to these meetings, you know, colleagues were saying that their population grew by 2 to 3 to 4 times because you had a new population of clients who realized that their traditional doctors did not afford them the preemptive prophylactic approach to medicine. Instead of reactive, treat me before, give me something to protect me. And this is what those of us in the functional medicine, the precision medicine, outside the traditional medicine arena, you know.
Yeah. And those are my favorite patients. Like I have a whole program now where it's just like health optimization patients. It's like, please come to me before you're sick. Let's look at everything you have. Let's, you know, figure out what you do have, what you don't have, and then let's optimize you so that you don't become sick. And those are like my favorite patients. Now I love the ones who come to me too that are just, you know, have been to a million doctors and no one's giving them answers. And I look at them and secretly inside I'm smiling because I know exactly what's wrong with them. I know they're going to get better, you know, but what's frustrating is they no longer trust the healthcare system. They no longer trust doctors. They've spent 10 years telling people they don't feel well because they don't. And people have missed little simple things. So that hurts my heart too. And I'm hoping in the next 10 or 20 years that there are more people coming to the good side of medicine, right? I try to get doctors. I take care of a ton of doctors. It's interesting because a lot of people in Oklahoma City, a lot of doctors think I'm crazy, or at least they used to. I would get like, oh, she's crazy. Don't send her patients. And now I see a lot of those doctors because I saw so many of their patients that went back to them and they actually are like, what is she doing? And so I see so many doctors now and I love it. But every time I see them and they get better, I'm like, do you want to come to the good side of medicine, like the functional medicine world? You know, like I try to get ER doctors, rheumatologists, like anyone I see, I'm like, do you want to learn how to do functional medicine? You can work in my office. Like, I'm trying to get them all to the good side of the world. Like,
Well,
so I'm hoping that one day we do that.
Yeah. Well, that means that, you've influenced your medical community, your patient community out there to the point where the colleagues are starting to say, wait a second, she's made a patient of mine, and they get so jealous because you fixed them where they were unable to do it. Yeah. I just want to train the docs. That's what I do. I've trained thousands of doctors.
Me too.
Yeah, you do. Because you want to share it, because we all can learn how to deliver from our experience, your experience, my experience, sharing the experience, how we can get patients to a higher level, higher quality of life, instead of suffering on medication, killing themselves.
My goals for 2025, I've had this goal, but I've had to put it on the back burner. So 2025, I'm going to write a book. I have a book proposal I'm working on, and it's actually going to be all centered around inflammation, like inflammation and how it causes a lot of disease. I would love to do a TED talk. I'm thinking about this as well. But my other goal in 2025 is to create some educational information for providers, because I have so many people who reach out who just want to learn, and I haven't figured out how I'm going to do it yet. But it's not that difficult, right? Whether it's just recording myself or something, because there's so many millions of people that need help. There's no way I can take care of all of them. We were talking about this before the podcast. Like, I would love to be able to help everyone, but I know I can't. And so the way you do that is by education and helping other people do it. And there's just not a lot of good information for providers. So that being said, I really appreciate what you do, what you've spent your life doing, which is finding out all this amazing information, making people feel better, and then educating people, writing books and doing all these talks. And so from the bottom of my heart, I appreciate that so much. I know your patients appreciate that. I want to ask you to let listeners know where they can find out more information about you. I'll put all your stuff in the show notes, but I want you to kind of tell them, like, are you on social? How do they find you? And then we're going to ask you the 3 questions. And then after you send me all this stuff and I look through it, we might have to have another talk, because I'm going to probably have more questions. So we might have to do another
not a problem.
part 2.
I'll make
with your daughter.
Available. With my daughter, you can spend the time with her. She's getting ready to give birth to her first daughter named Mia.
Exciting.
So if people, I'm an educator, at USC for a number of years, at UCLA for 1 year, training their docs. And then I travel a lot internationally and then nationally with different organizations, ACAM, A4M, AMMG, and so forth. But my website is tbihelpnow.org. And under the science section, you can find a number of the articles that I've written. Some have been published on psychedelics, on clomiphene as an alternative to testosterone, on projects that we've done with the military, with Camp Pendleton in California, with the Department of Health and Human Services in Texas, project that I proposed for when I was at the Pentagon with my partner in August. A lot of educational issues and media center. So some of the programs that I've been on, Montel Williams, NBC, CBS, ESPN, and sports and so forth, is there as educational vignettes so that you can learn. And then my daughter, Allison, said, Pop, you've got so much content. Why don't you go and open up a YouTube channel? Yeah. So I opened up a YouTube channel, and what I've been doing is populating it with things from little brief sections from some of the Joe Rogans and some of the other podcasts that I've been on, and then started a new series called Peptides for Health, because I get a lot of calls on, okay, I broke a bone, what should I do? Or I tore my shoulder, what should I do? I've got, shoulder dislocation or a hip or whatever. or spinal fusion surgery. What can I do? So I started a podcast, a video. They're 5 to 10 minutes each on different peptides, and then every Tuesday, every second Tuesday of the month at 5 o'clock Pacific Standard, I put on a private presentation for a half an hour of a particular peptide. There's articles on pregnenolone, DHEA. I'm expanding into some of the products, like we have Brain Rescue 3. Over the past 16 years, developed some products which are being used by people with traumatic brain injury, migraine, seizures, multiple sclerosis. Have a 95-year-old that I spoke with yesterday. He's been on our program for 2 years now. He had dementia. In 180 days, 6 months, his dementia was gone. He's, just unbelievable. He turned 95 yesterday, so we had a conversation. You can reverse these things. A 39-year-old with multiple sclerosis tells his story on how he came to us and what he did. He did the whole thing. I just incorporated it into the educational aspect to it. Why did it work? So the science behind how things work. And that's what I look for. I look for causation. So those are the best places: the YouTube channel under Mark L. Gordon, and then the website tbihelpnow.org under the science or media. And there's a lot of information, and you can just pull it down. Everything is you take it, you can download it. It's about education.
I love that. So let's ask you the three questions. Okay, are you ready? Right, don't overthink them. Don't overthink them. First question: what is the one food that's most beneficial and why?
The one food that is most beneficial in life. Well,
and why? One food that's most beneficial and why? Why is it beneficial?
And why? Well, people might not say water is the most important food in life, but for me, water hydration is the best. For me, is one. But if you want a real food, I'd have to go with a nice piece of filet beef, because of the vitamins in it, the minerals in it, the B complex, the mitochondrial. There's some CoQ10 in it. There's just incredible creatine. There's a lot of benefits to it. Anyway, red meat. Muscle.
I love it. Yeah. I love it. What is one thing that anyone can do for their health that would improve their health that's completely free, so it doesn't cost any money?
Exercise. High impact interval training, high impact aerobic training, any kind, because it increases a lot of the beneficial chemistry of the brain, like the brain-derived neurotrophic factor increases.
Yeah, and I'm going to say number 2, after listening to you, would just be some mindfulness, like practicing mindfulness, positive thoughts, like, meditation, that type of thing as well. Yeah, I think that the world,
meditation.
Yeah, I think the world needs to really consider putting this into education and school. I don't know, making like time at work. Like I just, it's really sad what this world has come to as far as like what we see, what we hear, what we think. If you just scroll through social media or watch the news.
Thank you.
So,
thank you.
Okay.
I had to be forced into Twitter, X. I had to be forced into it. My daughter, being a millennial, she said it's the way to do it. Okay. But I agree with you. I do 15 minutes 3 times a week of meditation, which drops cortisol, which drops fractalkine, which invigorates the brain, has a lot of benefits.
Okay.
And
exercise.
And find my frequency.
Good. So steak, exercise. Last question.
Okay.
What is one thing you wish you would have known about your health 50 years ago that you would have done differently after everything you know now? What's that one thing that you're like, man, I wish I would have did that differently?
I was 13 years of age when I got my first subscription to Prevention magazine. I'm 72. We'll be 72 January. So I've been looking at alternative health since I was 13. Okay, so that was 19 66. So 50 years, 66. I've been doing it for 50 years. So right now, I wish I would have written the papers on the benefits of growth hormone, which I think is by far the best hormone ever. But
I would agree. I would agree. I take a little bit of growth hormone. So, so growth hormone. So Dr. Mark Gordon, thank you so much for being a guest on Back to the Basics. This was fascinating, mind-blowing for me. I love when I learn new things. So you taught me a lot of new things. So I'm very gracious for that. I know my listeners will be gracious for that. If you enjoyed this episode, please make sure that you like it, follow us on social media, find Dr. Gordon's YouTube, and make sure you share this, because this is the reason we do this. It takes a lot of work, and we want you to share it with people so that we have education to provide to people. So please share this with anyone that you feel like would benefit from this. Also leave us a review, and we'll see you next week on another episode of Back to the Basics. Thank you.
The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.